The information contained in the SSI Spotlight series is designed for and intended for use by the NCAA membership. The webinar content represents the views and opinions of the participants and does not necessarily represent the views or opinions of the NCAA. The content has been made available for informational and educational purposes only. The NCAA does not make any representations or warranties with respect to the accuracy of the content, nor is the content intended to be a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The webinar is intended for personal viewing only and may not be recorded.
Hello, everyone, and welcome to today's SSI Spotlight. Thank you so much for joining us for an important conversation about relative energy deficiency in sport, or REDS. REDS affects multiple aspects of an athlete's physical and mental health, and also their athletic performance. Despite its wide-reaching impact, REDS often goes underdiagnosed, underrecognized, compared to other sports-related conditions. Many symptoms can be subtle or mistaken for normal training fatigue, which means athletes may continue competing while their health deteriorates. Raising awareness is essential to promoting early detection, proper management, and long-term athlete well-being. During this session, we will explore what REDS is, why it occurs, and how common it is. We'll also discuss its effects on physical and mental health, performance, and strategies for prevention and education. We're so fortunate to have Dr. Kate Ackerman here to share her knowledge and experience. Dr. Ackerman, thank you so much for joining us today. Could you please start by introducing yourself and telling us a little bit about your experience with REDS in elite athletes?
Yeah, well, thank you for having me, Dr. Casiero. So my name is Dr. Kate Ackerman, and I am a sports doctor and an endocrinologist. I've been really fortunate to be part of the International Olympic Committee's working group on REDS. We now call it REDS. It used to be REDS or RED-S, but I guess now we've moved to REDS and we got rid of the hyphen. That was the latest update from our 2023 updates. In my clinical practice, I've had a lot of experience treating REDS because we see these athletes who push really hard, they're really disciplined, and they tend to sometimes just overdo it. Sometimes they underfuel purposefully because they're trying to have what they think is the ideal physique. And other times it can be inadvertent and they just don't realize how many calories they need for how much they're expending as athletes. So I'm the director of the Women's Health, Sports, and Performance Institute. Basically, we opened this institute and this medical clinic earlier this year, and I'm an associate professor of medicine at Harvard, where we do research in the neuroendocrine unit at Mass General, in addition to our Women's Health, Sports, and Performance, or WISP, Institute on REDS.
That's great. Thank you for sharing that. I am so excited for you and your institute and the work that's coming down the pipeline from you. You've always been someone that I certainly looked up to when I was practicing as an expert in this field. So I can't tell you how much I appreciate you being here with us to share some of your expertise. So let's really start with the basics. And can you talk a little bit about what relative energy deficiency in sport actually means?
Certainly. So basically, REDS is about not getting enough calories in for how much people are expending. Basically, when somebody isn't fueling enough, like I said, it could be that underfueling because they're trying to keep a physique, or they just don't know how much they need. We have different fueling needs at different times of our life. And so relative energy deficiency is about this prolonged or severe low energy availability. And that can have enormous consequences on different health parameters and performance parameters. And I think that's where it really resonates with a lot of our athletes. It's not just about one organ system or one performance aspect. It has a lot of different outcomes.
Yeah. What are the main factors that lead to athletes developing this condition?
So we know that any athlete is susceptible, and this term REDS really stemmed out of work that was done ages ago in female athletes. So initially we had the female athlete triad, and that was a term that came out in the 1990s for low energy availability, and then menstrual dysfunction, and then poor bone health. And then it was expanded, and it initially expanded in 2014 with the IOC when they were doing their female athlete triad update, and they realized that low energy availability can happen to men and to women, and that it isn't just about bone health and reproductive function. But yes, that's the case in women and in men. But then there are other aspects with GI dysfunction and impaired energy metabolism, and we can go through those. But it can happen in leanness sports. So let's say an athlete who needs to make weight, like a lightweight rower, male or female, or it can happen to a jockey, or it can happen to a wrestler. But it can also happen to some of our athletes who are doing major exercise expenditure. So an open weight rower can have low energy availability and have REDS. So we realized that while there are certain aesthetic and weight restricted sports that are more susceptible, we see it in every sport and all sorts of types of athletes.
Yeah, I think that's so important to remind folks that this isn't just a female athlete issue, that this isn't just a leanness sport issue, and that it really can happen across the board. So how common is it?
So we can see different percentages in different populations. It is more common in those leanness sports. It is more common in women. When we talk about the research, it really depends how the research was done. So was it done with a survey? Was it done where we actually calculated the energy availability? So when we talk about female athletes and the publications that are out there, it's somewhere between 20% and 79% of female athletes, depending on the sport and how it was done. When it comes to our male athletes, it's somewhere between 15 and 70%. So those are huge ranges. And again, how was the study done? Did they measure? Did they ask for, did they just do a survey and say, hey, do you have an eating disorder? So that's why we don't have perfect numbers. When we get into specific populations of athletes, then and we tease out the different types of athletes, the different age of the athlete, the different elite level of the athlete, then the numbers are different.
Yeah, I think that that's why it's so important to talk about this topic, because those ranges are so broad. And when a particular condition has a range that broad, we have to make sure that clinicians and folks are understanding and looking out for this so that we can recognize it amongst our athletes. So I appreciate that. So now that we've covered what REDS is, and it's a little bit about its prevalence, let's talk about its impact. So this condition doesn't just affect energy levels, as you mentioned. It can influence both physical and also mental health, as well as athletic performance. So let's explore that side of the conversation and talk a little bit about the early warning signs that not just athletes, but that coaches or healthcare professionals should be looking out for in their athletes.
So this is a great way that the athletes, the athletic trainers, the coaches all can be kind of checking out each other and double checking if people are falling off of their normal performance. So if an athlete is more moody, or if the athlete isn't responding as well to a workout, or if they're missing more training days, we talk about athlete availability. So if somebody's getting injured more or they're getting sick more often, it could be REDS. I think there's been a little bit of controversy out there of how do we know if it's REDS, make sure that we know that somebody's getting a full workup, so we're not calling everything REDS, because there's a lot of crossover with other issues. But we want to be paying attention to our athletes to see if they're sort of falling off the norm. So from a coaching lens, if an athlete doesn't perform as well, or is acting differently, or is noticeably losing weight, or they're not eating with their teammates, those are warning signs. From the medical side, if an athlete is feeling more run down, if a female athlete is losing her menstrual cycle or getting more menstrual irregularity, if a male athlete is having changes in libido, morning erections, changes in that, these are actual physical signs that are notable. And so those are just kind of the tip of the iceberg. And after that, more things can become more obvious. But I guess the key thing here is if you're noticing differences, they should be addressed. And that's why we have medical staff to be doing some of the investigation for them.
Yeah, that's great. I remember when I was working as a team physician, the various different ways that I saw REDS present in athletes, and fatigue was really up there in terms of that initial. And it's tough because there are so many great reasons for an athlete to be tired, right? it's really hard to tease out, are they tired because of reds or because they didn't get enough sleep or because they had a tough practice? So it really is, it is complicated. And so are the symptoms always subtle, or do they sometimes kind of really come out of the blue quickly and sort of smack you in the face?
I think it depends on how quickly it's developing. So if somebody immediately goes on a crash diet because they need to make weight for a certain event, the symptoms might not be that subtle. If somebody has been pushing hard for a while, so let's say you have an athlete who transitions from high school to college and now the training is much harder, they're doing more volume, they haven't kept up with their calories throughout the fall. Let's say it's a cross country athlete, they're just sort of getting slower, feeling worse, dropping some weight, moods affected. And you're trying to tease out, is this an adjustment coming into college? Is this an adjustment in mood? Is the person just depressed? Did this person develop hypothyroidism? Is it that, so it's a lot of different things that could be presenting at once. Are they overtraining? Is the food intake fine, but they're just doing a huge volume? That's the subtle part. That's the art of medicine, is determining what it is. Did they become really iron deficient because they just are training so much more and they're not getting good iron in their diet because they don't have great food at their new university? There's a lot of different things there.
Yeah, that really hits too on something else I wanted to talk about, which was this idea of intentional versus unintentional reds, right? And when you talk about dieting or other things, I think there's different ways to think about it. So in your experience, do you see reds mostly as sort of a manifestation of intentional decision making, or most of the time is it just the athlete's not really understanding enough about that balance?
I'd say more than not, it's the not understanding that balance. I don't think most athletes go into sport thinking, I'm going to develop an eating disorder and I really am focused on my sport because of my body image. They're going in to be a really competitive athlete. They're loving sport. They want to be successful. So more often than not, the people that I see who get into trouble with reds are really well-intentioned, really hardworking people. They tend to have A personalities and be very driven by success. And then they kind of just got caught up in overdoing it a little bit, partially because they didn't have the right knowledge, especially our younger athletes, our adolescent athletes who are just starting to shine. And there's a lot of attention on them because they're succeeding. So for example, I use the cross country athlete as an example. You get this female athlete who's the fastest one on her team. She's been doing more workouts because she's seen the short gains where she's now fast and people are praising her. And she knows that, oh, if I stay light, then that's going to help. And then what she doesn't see is that she's going to fall off the cliff. She's either going to get injured or she's going to start getting slower. But in the first part of that, she loses her menstrual cycle and she's thinking, great, I don't have my period, but hey, I'm running fast and I'm training hard. And so it's not really that she's meaning to restrict. It's just sort of happened that she stayed thin and maybe she's not trying to gain weight because no one's told her to. And I think with our elite athletes, I've seen people get into that higher level of training at the collegiate level. Again, an open weight male rower who is doing a lot of volume and he's taking a bunch of hard classes and he's not necessarily getting recovery snacks and he's not realizing just the volume of food that he needs to have. So I've had heavyweight male rowers who need over 10,000 calories a day. And most athletes wouldn't think, oh yeah, I definitely need to eat 10,000 calories a day.
Yeah, no, absolutely. One of the things that I think back on when I was treating athletes and identifying reds was this phenomenon of it can't be my fueling because I always have eaten this way. This is always what I would eat before a race or eat while I was in the height of my training. So, doc, that couldn't possibly be what's going on with me. How do you navigate those conversations with athletes?
So one of the things I try to emphasize is we're on the same team. I want them to absolutely perform at their best. I want them to be able to see how far their career can go, what kind of records they can break. So we're on the same side. And I try to help them understand that. And then I say, look, we have all these resources here. At WISP, we have sports nutrition, we have sports psych. When I work with, I'm the head doctor for US rowing. When I work with our national team athletes, I say, we have the resources. We're lucky we have these resources. Humor me. Just humor me and go meet the sports dietitian and let them pick the diet apart. They're going to spend at least an hour with that first nutrition eval, and they'll do some equations and they'll do some assessment that might be just educational for you. We definitely run into a lot of people who have spent some time learning things, some of it online, some of it in textbooks. So they think that they're really knowledgeable, and they probably are more knowledgeable than the average person, but they haven't really applied all the other things that can come into play. Hey, your metabolism might have sped up. Hey, you might be burning more calories than you realize because you weren't counting the commute on your bike or the run to the boathouse or the walking all over campus. Let's trust the professional just to do this assessment. And if they say you're doing great, cool, I believe you. The other thing is we have, athletes are smart and they want to have proof. So sometimes that's where some of those biologic markers, those lab values can be helpful to us. And that's where I think we have this thing called the REDS CAT2, the REDS clinical assessment tool that also came out. The second version of it came out in 2013. I'm sure we'll have a third version and a fourth version as we learn more. But this way we can apply a point system to kind of help prove to the athlete where they are on a spectrum.
Yeah, that's great. And I definitely want to get into the screening tools and other things that folks listening in can tap into if they haven't already. But before we get there, I wanted to talk a little bit about the mental health aspect of REDS, right? You mentioned earlier that REDS touches multiple physiological systems in the body, but we also know that there are some mental health and overall well-being aspects that come into play as well. And so do you see links between REDS and issues like anxiety, depression, and, as you mentioned, disordered eating?
Absolutely. So yes, we see changes in urinary function, skeletal health, cardiovascular health, lots of different systems. But when it comes to the mental health component, there's sort of two aspects. One is cognitive function. So when there aren't enough calories in the body, people don't think as clearly. And when somebody has depression, that can affect how much they're eating. If they have anxiety, that can affect how much they're eating. And then vice versa, if they're not eating enough, that can lead to depression and anxiety. So in our REDS models, there's actually an arrow that goes in both directions. So REDS is the center, that is the cause that leads to these outcomes. The low energy availability is in the center. And then at the outside of our wheel is the REDS signs and symptoms and the dysfunction. When it comes to the mental health, it's low energy availability affecting mental health and vice versa. So it's important for people to realize that someone who's depressed might not want to eat as much. Someone who's depressed might not have as much appetite. And then when somebody's exercising a lot, that can even suppress their appetite and affect their energy availability, which is going to affect their mental health. So it's very linked. And separately, when you diagnose somebody with REDS because you found other symptoms, that can be really shocking to them. And they feel like they've done everything right. Like I said, they've been very disciplined and motivated, and they've tried to do all the right things. And now you're telling them, oh, actually, you have to change some things. You have to change how much you're training. You have to change what you're eating. You need to come in for a bunch of medical appointments. And that can be stressful and really daunting on a person.
Yeah, I totally agree. It makes me think about an analogy I used to use with athletes was about, when you're an elite athlete, you are like a Lamborghini. You are a high performance machine that is complicated. And when you open the hood and you look inside, it's complicated. There's a lot of wires and tubes and pipes, and you wouldn't put really bad gas in a Lamborghini, and you certainly wouldn't expect it to operate on no gas. But there's also lots of other things, the right oil and the right maintenance schedule. And so when I would try to get athletes to buy in, so to speak, right, to this possibility that this REDS could be what is going on with them, I would say, let's get the car into the garage, right? And let's look under the hood and let's pick apart these things, because you're right, the mental health conversation is a tough one, right? Because they may not feel in that moment that there's anything going on with their mental health. But when you incorporate that in just another wire under the hood that we need to look at, tighten, tweak, or adjust, it starts to all make sense. And I also think it makes the athletes feel a little bit more comfortable sort of accepting that something could be going wrong and maybe it wasn't my fault. Maybe it's just because my body is complicated and my sport is requiring a lot of me. And this is just part of what it means to put a sports car in the shop for a while to take a look under the hood.
Yeah, and I would add to that awesome analogy and say, and we are your pit crew. So you are this really great car, and we don't want it to go driving off the cliff or getting into an accident. So rely on your pit crew, which is the dietitian, the mental health specialist, the physician, the athletic trainer, the exercise physiologist, whatever is around. Absolutely. I like to think of them as these awesome sports cars as well. And I think the part that gets a little bit tough is not everybody at every institution has all the resources to take care of that. So the pit crews can be different sizes. The pit crew could have a few people on campus or a lot of people off campus, but it's building that pit crew, whatever it looks like, making sure that you're getting these athletes the right resources and reminding the athletes that it's okay to lean into that support.
Yeah, no, that's totally on point. I want to pivot a little bit to performance. We know that athletic performance is obviously incredibly important to athletes and to their coaches. So what, what are the particular performance measures that, athletes might sense or coaches might sense that are a little bit off?
Well, some is just frequent injuries. So getting injured more frequently, having more frequent illnesses, having less recovery. So they do a workout and they don't feel as recovered. So they have a decreased recovery, decreased training response, decreased motivation. Sometimes there's just more apathy around training. And then I think that athlete availability part is really important. So just if people aren't being monitored super closely, but they see, oh, well, Sally couldn't make this workout, or Sally wasn't quite right then, or, oh, Sally has broken something else. We know that athletes are going to perform better the more that they can show up for their prescribed workouts. If you're going to miss a third of your training, you're not going to perform as well. So some of it is subtle. Some of it's just these little changes in how they're doing. They're not getting the gains that they think they should with the training plan and not responding in the same way that their teammates are.
Yeah, I'm glad you brought up monitoring because, one of the questions we want to make sure we answer to for the audience is, how can we promote awareness of this condition so that it isn't just the medical staffs sort of monitoring for these changes, but that coaches and parents and others can sort of be looped into how to recognize these types of conditions?
So that's one of the things we're really passionate about from a research standpoint is what is the most effective way to get this information to people? This is one great way. We're planning a research study that's a bit of an intervention at different universities to see what resonates most. Is it teaching the athletic trainers? Is it doing webinars for students? Is it student-led peer-to-peer education, just to start to recognize the signs? The monitoring is really an individual thing. I don't think that everybody has to wear a zillion different heart rate monitors and different wearables, but some of those can be useful. And that with a training plan, there is monitoring. There are metrics. Again, I'm a rower, so I'm coming from what are the splits on the erg? Is the heart rate responding in an appropriate way? Is the morning heart rate too low or too high compared to how it's been? So when you see these changes, there's a reason. Often it's because someone's just sick, or is it because they're getting run down? And it's not the coach or the athlete's job to determine what that is. It's their job to say something is off, go to a resource and go get that looked at. Because there can be a lot of reasons, like we said. Does the person have mono? Do they have iron deficiency? Do they have REDS? Do they have all these different options? But it needs to get evaluated.
Yeah, and I think there's a certain, I don't know if stigma is the right word, right? But certainly there's a stigma around eating disorders, and there's potentially some trepidation around, does this mean I have an eating disorder, or, I don't have an eating disorder, right? And sort of getting coaches a little bit more comfortable with having those conversations so that it doesn't come off judgmental or come off like you're assuming that somebody is purposely restricting their calories. And I think that that's also too where we could probably make a lot of progress to sort of normalize the condition. to clinicians like you and I, it is so obvious why this exists, because it is
Right.
so easy to get the body out of balance when it comes to energy intake and energy expenditure. But I think that's another area where we could probably progress a little bit.
Certainly. And I think coaches are in a tough spot. They're concerned now. What can I say? What can I say? Am I overstepping? Am I not? With safe sport, am I allowed to mention anything? Am I allowed to make comments? So I do have a lot of empathy for our coaches because they've come to me and said, I don't even know what I can say anymore. So as you know, we did a pre-conference this year with our female athlete conference, and it was intended for coaches where we spent a lot of time talking about this. And it's tricky. I think keeping a global conversation going. So as a coach, you can talk to the entire team and say, hey, I'm coaching a female team. Hey, women, just so you know, if you are losing weight or unintentionally losing weight, or you're losing weight purposefully but don't have a dietitian helping you, please go see the dietitian to help you do it in a good way, in a productive way. If you are discovering that you have menstrual irregularity or you're losing your menstrual cycle, you don't need to tell me, the coach, about it, but that means you should go and talk to the medical staff. I think those are global ways that you can talk to the whole team to say, hey, I'm a coach and I know a little bit about this, and these are the signs I know about, but I'm not necessarily going to single you out. Separately, if I see that you don't seem right to me, if you look like you're a little off or you're seeming more depressed, if I say something to you, it's because I care and I want you to have a great performance and a great experience. This isn't punitive. This is so that we can get that race car doing its best.
Yeah, I love that. I think it's so important. And it kind of leads us back around to screening, right? So, there may be times where we have athletes that present with symptoms that sort of make us think along this avenue. But other times, screening for issues like this ahead of time, even before significant signs and symptoms arise, are important. So you started to mention some of those screening tools. I'd love to hear a little bit more about the ones. We have folks on this call who are taking care of NCAA student athletes across all 3 divisions with varying degrees of resources. And so would love to hear from you a little bit about some of those screening tools.
Well, one of the things is just doing a pre-participation exam for all of our student athletes, and that's an opportunity to collect some data. So we know that there is a PPE that's endorsed by a lot of organizations, and we recommend that people, as they're starting their season, that people have their pre-participation exam. So in a big group setting, to add to that, we can be doing some questionnaires just to ask the athlete. And so when we talk about the REDS CAT 2, step 1 is a questionnaire. It can be done in a group setting. And I'm not being specific about the eating questionnaire. You really should find one that's appropriate for your population. So we have a publication where we listed the different ones that are validated in different populations. Let's say it's a collegiate group of males, or it's an adolescent group of females, or it's an elite level, Olympic level athlete. These are the different questionnaires you can use, whether it's the BetaQ or the DESA. There's all different ones. So we can link to some resources about how to pick your questionnaire. So step 1 is giving the questionnaire, and if people answer positively to too many questions about food or eating disorders or body image or whatever, then we know, all right, we got to go to step 2. And step 2 means we have to do we have the athlete get evaluated by the medical team. And the reason we have that is so that you have a wide net. You could have answered yes to a few questions, and you get the workup and you're actually fine. Or you get the workup and now we're actually ordering some blood draws. We're doing a bone density scan with body composition. We're asking more questions about menstrual cycle. And now we're into the privacy of the medical visit. So the coach doesn't need to know about this. But here we're doing the screening in the REDS CAT 2, where we're finding out about the hormones, the menstrual cycle, bone stress injury history, bone density. And then with all of these different questions, there's a point system. And then they go to step 3, and they're put into a risk category. And our risks are green, meaning you never got to step 2, you're totally fine. Yellow, orange, or red. And in those, that's basically just your risk for red. So after all of that, then you're talking about the medical diagnosis where, okay, we found out about their bone stress injuries and we found out about their hormone levels, but are we missing anything else? And that's where the doctor needs to figure out, is that all tying together? Is there one unifying diagnosis that is this low energy availability leading to REDS? Or is there something else? Let's say malabsorption. Do they have a GI issue that has led to all this stuff? And that's, again, the art of medicine, making sure that we're not missing anything. But within all of that, those categories, this is where we're applying maybe some restrictions on activity, maybe interventions with nutrition and mental health. But the amount of activity that's allowed at those different stages can vary depending on how much the athlete's buying in, how severe the state of the athlete is. So if they're in the yellow range, that just means, hey, we want you to meet with the dietitian and do some labs, but you can keep training. Orange means, okay, we probably have to back off on your training. You can do some, but we need closer monitoring. And red is, well, you really have a medically significant condition. We're worried about your cardiovascular health. We're worried about how low your heart rate is. There's other things that make it really unsafe for you to be exercising right now until we get you out of the woods. And then we want to back you down to the orange, and then we want to back you down to the yellow. So none of this is, hey, you're not allowed to exercise ever again, but it means we got to have the right level of attention on you to keep you safe.
Yeah, what I think is so great about these tools is, when I started practicing medicine with college athletes, tools like this didn't exist to sort of help me decide when is it time to progress the athlete to the next step? When do we get labs? When do we pull back on participation? And so I think really important, and we will link to some of the resources that you mentioned in the chat so folks can click on those. I think it's really important to know that there are resources out there that can help athletic trainers and team physicians navigating through some of this, just to give a little bit of a roadmap. And as you mentioned, Kate, it's important to remember that, there's a little bit of the art of this as well, right? There is no blueprint for the perfect way to treat individual patient through REDS. There is definitely some individuality to it, but to have tools that exist like this to give folks a roadmap, I think is just really helpful. So thanks for bringing
that. And I
up.
think in medicine, we know that these tools get updated. There's different versions of our pre-participation exam and different editions as we learn more. Same thing with our concussion screening, same thing with this. So this isn't the final story. As we learn more, as we discover more markers that are really helpful, the more we'll be able to do this in a better way. But we got to start somewhere.
Yeah, no, that's great. I want to take the conversation back to the pit crew that you mentioned earlier. Obviously, REDS is a complicated condition, and it isn't something that can or should be treated just by an athletic trainer or just by a primary care team physician. Can you talk to us a little bit about the different sort of multidisciplinary approaches and who folks on campus could reach out to, whether you have somebody on your campus or perhaps you have to dip into community resources to build that multidisciplinary team?
So I think at a minimum, a physician and a dietitian and likely a mental health specialist, because of the changes that you're asking the athlete to make, they're going to need mental support. So that's sort of our trifecta, top of the food chain. And then you have people that can be really supportive who are going to see the athlete more frequently. So the athletic trainer is somebody who's going to have a really close relationship likely with the athlete. So for example, I'm not on campus. People are referring patients to me, and I'm helping with the medical diagnosis and the management and helping to make some of the decisions. But the day-to-day interaction is likely happening with the athletic trainer who's seeing the athlete at school. So there you can have this nuanced approach. Somebody could be going off-site to see a specialist, and then they could get their weight checks done on campus with their athletic trainer or with the medical staff. So it really depends on what's available. Sometimes when we're talking about our elite athletes who have a lot more resources, it could be there's an exercise physiologist involved. There are other ways to monitor how the athlete's getting better so they're able to do more physiologic testing along the way. If a patient is presenting and they have an injury, then the physical therapist is super valuable too. So they're keeping the athlete moving, they're working on their muscle imbalances, they're figuring out ways that the athlete can exercise without making it worse for the actual injury. So the team can be a little diverse depending on the exact presentation of the athlete.
Yeah, and I think it's important to embrace that diverse grouping, because when you're treating complicated conditions, it's always easier when you have more folks sort of weighing in on their individual expertise to try to get the athlete to where they need to go. So I totally agree with that. And I want to talk. Yeah,
I'm
go
going to
ahead.
interrupt you for 1 second. The other point I would make about that is one of my favorite examples of how this shouldn't be is when it's not diagnosed and people start going around to different specialists. So years ago, I had an athlete who was a collegiate athlete, and she had constipation and bloating. And so she saw the GI doctor. And then somebody thought that she wasn't eating enough. And so she saw adolescent medicine about her eating disorder. And she'd had multiple stress fractures. So she went to sports medicine about her fractures and on and on. So she had about 8 different doctors that she was seeing, and people didn't put it together. So it's also important that people are aware of this and that the pit crew is talking to each other. The team really needs to be unified in their messaging and understanding what else is going on with the athletes so that they're coordinating the care.
Yeah, so important. Thank you for tying that up in that nice little bow. That was perfect. So what about education? I mean, obviously it's important for us to educate athletes, coaches, athletic trainers about this. So what does effective education look like in this space?
I think at this stage, it's a lot of throwing spaghetti at the wall and seeing what sticks. We know that there are some physicians who are not even familiar with the term. We don't have an ICD-10 code for it. You know, we have ICD-10 codes for low caloric intake or eating disorder, but we don't have one that specifically says REDS. That makes it harder to determine prevalence and to determine who's treating this and who isn't. I know that when we have conferences, it's coming up more and more at sports medicine conferences. It's coming up more on campuses, which I think is fantastic. You're talking about it here today. With our WISP Institute, we have a big push about this. So we opened our practice in September. We're launching the Institute nationally in January, and our website is coming out later this month where we have more resources on that. But I think it's really about whatever resonates in people's communities, and everybody needs to take different stabs at what works. Years ago, there was something called the Female Athlete Body Project, and that was a peer-led group. So that's one of the things we're trying to build off of and saying, hey, can we be doing something like that more with REDS, getting people on campuses to be talking to each other about it? It's because a lot of times people are going to believe things if they have student representatives and colleagues and peers telling them about this more so than professionals, doctors, old people like us. I really love when athletes who are elite athletes who've gone through this have really spread the word via their social media channels. And when I've treated those elite athletes and they come through the other side, I beg them, please talk about it. Please be brave and put it out there, because you have all these followers, these younger followers who don't necessarily know how you got to this place. And so there's some really great role models who have talked about their struggles and have become very public about it. And I think that's been really helpful too.
Yeah, that's a great point. I've had a couple athletes over my career as a team physician, fight me tooth and nail all the way through. And then at some point they come back and say, thank you so much for not giving up, for continuing to bring this up, even though I didn't want to hear it and I didn't want to listen to it. And you're right. When they turn around and use their voice and their position to send that message to current student athletes, it's so effective. And the other thing I think is just talking about it, right? The more we talk about REDS, the more we, whether it's during a pre-participation physical exam or during a preseason talk for a team, when we talk about things like sickle cell and mental health support, right? Talking about REDS as a thing that just exists amongst athletes can be really helpful from an education standpoint. So that's great. Well, before we wrap up, Dr. Ackerman, I wanted to give you an opportunity to say any last words or have any last comments. I really appreciate you being on today.
Well, obviously, I'm a huge fan of you, and I love that you're making space to talk about this and really highlight different topics that are important for NCAA athletes. I'm excited about the research projects that we're going to be doing to try to get more knowledge out there to the masses. And I think NCAA projects to raise awareness are always effective. So you're the leader of the collegiate system, and I think when we see change at the top, that really helps. From top down and bottom up is the way that we need to go around trying to nip this in the bud. But again, back to your point about shame, there shouldn't be any shame about it. This is something that is so common. It's like if you had shame about tearing your ACL or getting a fracture, like this is part of being an athlete, is some of these things happen, and it's how you manage it, how you embrace, here is the issue. Now we just need to get on top of it and just accept let's do this. This is part of training.
Yeah, no, that's great. And I'm going to throw the accolades right back to you, because we at the NCAA wouldn't be able to project all this great work if clinicians and researchers like yourself weren't doing this great work. So really appreciate you as a friend, as a colleague, and we will certainly be working closely together on this topic in the coming months and the coming years. So thank you so much, Dr. Ackerman, again, for joining us. We really appreciate it. And thanks to our audience for attending today's session. Please don't forget about your certificates of attendance. They are available. You'll find instructions on how to access those in our chat. Please email us at ssi@ncaa.org with any questions or suggestions. And we look forward to seeing you all at our next SSI Spotlight.